Types of headache. Headache is probably the most common type of pain experienced by human. There are two types of headache. First one, primary headache, and second one is secondary headache. And in primary headache, there will be tension headache, migraine headache, cluster headache. In secondary headache, it mainly due to any of the disease condition, that is sinus headache, new daily persistent headache, hypertension induced headache, TMJ disorders related headache. So in primary headache, the first one, tension type headache. Tension type headache, this is the most common type of headache. It is characterized by its bilateral location and pressing or tightening quality. Tension type headache usually mild to moderate intensity and not aggravated by physical activity. Tension type headache again categorized in episodic, frequent episodic or chronic headache. So tension headache means here there will be bilateral location of pain and it is tightening type of pain, and it may vary from mild to moderate, and it is not aggravated by physical activity. So that type of headache, it is known as the tension type headache. It may occur as a result of sustained and painful contraction of the muscles of the scalp and neck. Tension type headache, it mainly occurs due to a sustained and painful contraction of muscles of the scalp and neck. And here there will be chance for the photophobia. Next one, migraine headache. Next primary headache is migraine headache. Here there will be a recurring headache characterized by unilateral or bilateral throbbing pain. There will be a triggering event or strong family history will be present or will be associated with the migraine headache. And the manifestations mainly neurological and autonomic nervous system dysfunction. And by puberty, the girls are more prone to get migraine headache. So migraine headache, there will be unilateral and bilateral throbbing pain will be experienced by patient, and mostly there will be a triggering factor or precipitating factor for migraine, and family history is the important influence in migraine headache. Mostly the females are affected more than males. And regarding the clinical manifestations of migraine headache, the migraine headache may exhibit with aura or without aura. The without aura, migraine without aura is the common migraine that occurs in people. But the migraine with aura, that is called classic migraine. So the migraine with aura, it is called classic migraine. And here the 10% of migraines are the classic migraine. Here the patient will have severe headache, and they sharply defined aura may be last for 10 to 30 minutes before the starts of headache. It may include sensory dysfunction like visual field defects, tingling or burning sensation, or paresthesia, or motor dysfunction like weakness, paralysis, dizziness, confusion, and even loss of consciousness that occur as an aura in migraine. So in classic headache, there will be the classic headache always with aura. It may occurs prior to migraine headache, and it may last to 10 to 30 seconds. And here the person will feel sensory dysfunctions like visual field defect, tingling or burning sensation or paresthesia. Otherwise, motor dysfunction like weakness, paralysis, dizziness, confusion or even loss of consciousness may be occurs as an aura in case of classic migraine. And here, as a clinical manifestation mainly, there will be edema, irritability, pallor, nausea, vomiting, sweating. All these problems will be occurs, and the disturbance in GI tract. Okay, so these all are the clinical manifestations of migraine headache. Next one, cluster headache. Cluster headache are rare form of headache affecting less than 1.1% of population, and it involves repeated headache that can occur for weeks to months at a time and followed by period of remission. So in cluster headache, there will be a period of headache for weeks to months and there will be a period of remission. And here the patient experience the pain is different from migraine or the tension headache. Here the pain generally located around the eye, radiating to the temple, forehead, cheek, nose or gums. The pain is pushing pain of migraine headache. It is not pushing pain, it is pushing pain of occurs in migraine headache. Here the pain is sharp and stabbing nature. And the most severe form of headache is the cluster headache, and the intensity will be last for 1 hour. And here it is generally located in eye and radiating to temple, forehead, cheek, nose, gums. Other manifestations are include swelling around the eye, lacrimation, tearing, facial flushing, pallor, rhinitis, and constriction of pupil. During the headache, the patient is often agitated and restless, unable to sit or relax. Most of the time, the patient will feel a severe and stabbing pain, so the person is not able to relax, and it may last for 4 to 8 weeks, and after that a period of remission will be occurs. So that is regarding the primary headache. Primary headaches include the tension headache, migraine headache, cluster headache. Next one, secondary headache. Secondary headache, the first one, sinus headache. Sinus headache means due to sinusitis, sinus problems sinus related problems. For example, the sinusitis or other sinus problems that may leads to headache. So the location of headache will be in the between the eyes, then in the forehead, etc. Next one, new persistent daily headache. New persistent daily headache means it occurs daily and the onset will be clearly remembered, and pain lacks characteristic features of migraine or tension headache. But here there will be persistent headache and there will be pain will be continuous and it will not be resolved within 24 hours. And this pain will be present for 3 months, greater than 3 months. So that type of pain is known as the new persistent daily headache, and not better accounted for by another diagnosis. So for new persistent daily headache means the person will feel headache daily and it will not be resolved within 24 hours and it may exist for 3 months. So that type of headache, it is known as the new persistent daily headache. Next one, temporomandibular joint headache. So temporomandibular joint headache means here due to a temporomandibular joint disorders, the person will experience some problems like while grinding or while clenching the teeth, there will be pain or soreness will be occurs, and this pain or the pain may radiate to the head, eyes, jaws, shoulders, back and neck. So this pain, the person will pain all these areas. The person will have pain on head, ear, shoulders and back and neck, and eyes, teeth or jaw. So all this pain that leads to a severe pain. And usually in shoulders and back and neck there will be lack of mobility, stiffness and tiredness of the muscles will be present. And the head pain, headache due to temporomandibular joint disorders, mainly in forehead, it may appear as a tension headache or migraine type headache, but it is very severe, and it will be aggravated by the clenching of the teeth or grinding or chewing. Due to that there may be high the severe pain. Primary headache are very important. So the comparison between primary headache, so the migraine headache, tension headache and cluster headache. The first factor is process. The migraine headache, it is mainly due to neuronal dysfunction, possibly of brainstem origin, involving low serotonin, spreading cortical depression and trigeminal-vascular activation. And they are in two types, with along with the aura and without aura. Along with aura, that is known as the classic migraine, and without aura is the common form of migraines. So that's regarding the process of migraine. In case of tension headache, the process is unclear and possibly it is heightened due to CNS pain sensitivity, involves pericranial muscle tenderness, and the main etiology is unclear in case of tension headache. Next one, cluster headache. The cluster headache, also the etiology or the process is unclear, and we are thinking that hypothalamic then trigeminal autonomic activation may be trigger the cluster headache. And location of migraine headache, that is unilateral. Most of the location of migraine headache is unilateral, 70%, but it may occur bifrontal or bilaterally. And tension headache, usually bilateral, may be generalized or localized. Cluster headache, usually unilateral and behind or around the eye, the cluster headache location. And quality and severity of headache. In case of migraine, there will be throbbing or aching pain, and the severity will be variable in nature. In tension headache, it is steady in nature, and the pressing or tightening and non-throbbing pain, the intensity will be mild to moderate. That is tension headache. In cluster headache, deep and continuous and severe headache. So most severe form of headache, that is cluster headache. And timing of headache. The migraine headache fairly rapid and reading a peak in the onset, the timing or the onset, it is fairly rapid and reaching peak in 1 to 2 hours, and duration may take 4 to 72 hours. The tension headache is onset is gradual onset. The cluster headache onset is abrupt and peak within minutes and last for 3 hours and sometimes more than that. Then course of migraine headache, peak incidence early in the mid adolescence, and prevalence is 6% in men, and mostly it is common in females. And the tension headache, usually the episodic, mainly sometimes it may be chronic, but the tension headache usually episodic in nature. Cluster headache also episodic in nature, and it may occurs with several days, that is 4 to 8 weeks. Then there will be a period of relief for 6 to 12 months. That means a period of remission. Then associated factors along with the migraine headache: nausea, vomiting, photophobia, aura will be present, and there will be visual problems and motor problems may occurs, or maybe occurs associated with migraine headache. In tension headache, usually the feature is photophobia, and the aura will be absent here, and also nausea will not be present in tension headache. Then cluster. In cluster headache, there will be lacrimation, rhinorrhea, meiosis, ptosis. All the eye problems will be present with the cluster headache. Next one, factors that aggravate or provoke. In migraine headache, alcohol, certain food, or stress, or the menses, or high altitude and noise, bright light, all this may cause the provocation of migraines. Tension headache, mainly sustained muscle tension, especially the driving or typing, all this may cause the tension headache. And cluster headache mainly occurs during attack. Sensitivity to alcohol may increase the chance of cluster headache. And the factors that relieve headaches, the quiet dark room, sleep, all this may help to remove the migraines. And in tension headache, massage therapy, relaxation therapy may relieve the tension headache. And cluster headache, it may be long with, it may persistent with 4 to 8 weeks, then there will be a period of remission. So that is regarding the primary headache and comparison.